Okay, so we're talking about how the late enrollment penalty works for Part D, not Part B, not the IRMA penalty, for Part D for drugs, and how to potentially avoid it. This is a tough video. It's very hard to explain, and I'm a little uncomfortable with having to go through this, without being like with a person, because I talk to thousands of people and it's so easy. So here we go. So number one, what is the penalty? How do we define it? So the penalty is, you have Medicare A or B. Okay. For years when I first started, many long time ago, I thought you had to have A and B to get the penalty. But no, if you just have Part A only, then you can get the penalty if you don't have a drug plan, a Medicare drug plan, or have credible coverage like through a job or through VA or something. In other words, you're eligible for Part D, which having A or B makes you eligible, and you don't have a drug plan and you didn't get it through another source. An example for that would be a person turned 65. They have Social Security, so when you have Social Security when you turn 65, Social Security income, Medicare automatically enrolls you. Okay, and not everyone knows that. So all of a sudden they're on Medicare and they may not know it. They are young, or they're healthy, not so young, but they feel young. They're healthy and they don't want to pay for it. And so they drop it. And then they find out 4, 5, 6, 8 years later, there was a penalty. They drop Part B and they actually went up with Part A only, which is free. So they're like, so they don't know about the penalty. So that's the penalty. The amount of the penalty is really super weird. The government figures this out. So they take all drug plans nationwide. There's usually 20-something drug plans in every county in America. And they take an average, which this year is $38.99. But most of the time for the last 15 or 16 years, it's been between 31 and 36 bucks. They take 1% of that, and so that's like 39 cents basically right now. And they multiply the number of months that you were uncovered. So you might have been, without insurance for 4 years, that's 48 months, and they multiply it times 39 cents, and that's your penalty. And it's a monthly penalty that is forever. Really annoying. So if you do something wrong and you do your time, then it's past you. But with the Medicare Part D late enrollment penalty, and you had a $20 penalty, they're going to get you forever, and you can change plans. It won't matter. You can change states, and it won't matter. If you have a drug plan and you have a $20 penalty, they're going to tack on 20 bucks no matter what you do. So that's how they calculate that. A couple of interesting points is they always route the nearest dime, and of course more confusion comes in. They have to change it every year by a dollar or two because the national average changes. So like I said, in the past, the national average was like 31, 32, 33, 34, 35 bucks. So the penalty was 31 cents per month that you're uncovered. Also, the cornerstone for that is to understand the number of uncovered months. If you're helping someone on Medicare or yourself on Medicare, understand how many uncovered months you have. And then you can understand your penalty better. But people focus on the penalty and then they forget about it, or just things change, and the next thing you know, they forgot they had the penalty, and then they're thinking their drug plan's 30 bucks a month. So if I get a $10 drug plan, they're going to add 20 bucks for the penalty. And the premium notice is supposed to say that, but they don't always do it. Depends on the carrier. They're supposed to. So if you understand your number of uncovered months rather than your dollars, you're more likely to remember it, because, I don't know, for whatever reason, when I tell people that, they're more likely to remember it. Also, no agent is allowed to tell you your penalty because we can only estimate it. I just tell people give or take 50 cents. It's round the nearest dime, so I just say, it could be off 50 cents or so. I'm usually really close. And then how to pay the penalties. I kind of already said that already, but they just going to bill you through the carrier. Now, it's imposed by Medicare, but the carrier is the one that bills it. So most people think it's the carrier that's penalizing them because they're getting a bill from the carrier, the insurance carrier, the drug plan you have. That's what I'm talking about. So it's only natural for you to feel like if you have such and such insurance company, they're sending you a bill, then there's their reason. They're penalizing you, but it's not. It's Medicare. So again, if I move to another state, thousands of miles away in the United States, and I decide, well, that penalty really pissed me off, pardon my French, then the penalty is going to follow me, no matter what. End of story. So, and then the most important part is how to avoid the penalty. The crown jewel of avoiding the penalty, and what is not said anywhere, is, it took me many years to learn this, is if you get extra help with drug costs, and I'll give you how to get that, then the penalty is automatically waived. And I'm talking even if you had the penalty for many years, and that really is like, people are like, thank God. So your extra help with drug costs is run by Social Security, but it works through Medicare, your Medicare drug plan that you happen to have. It can work through any Medicare drug plan. So it wouldn't matter what plan you have, it can work through it, and it lowers your drug costs and eliminates your medical deductible, your drug deductible, excuse me. If the income limit on that, if you're single, is going to be $1,995 a month. If you're a couple, $2,705. The asset limit is $18,000 and change if you're single, not including your house, your car, and certain like personal items. And then your if you're a couple, it's $36,000 and change. So you could potentially get extra help with drug costs and it waives the penalty. That's the easiest way. But there's a couple of other ways. Once you have the penalty, it's been 90 days, you can't get the penalty waived by talking to the carrier like you could in the first 90 days. That's kind of another subject. But after 90 days, many times people will understand the penalty years later, there's an appeal, and they don't call it appeal, they call it a reconsideration form. But it's basically an appeal, and you have to fill it out. It's from a company called C2C Innovative Solutions, and it's not terribly hard to find it. You just Google C2C Innovative Solutions, and you'll find that form, and you can submit it to them, and they will consider waiving the penalty. And you had to have credible coverage during those months or years when you got the penalty for. The other way to waive the penalty is, or to not get the penalty, is just get a Medicare drug plan when you're first eligible. So I have lots of customers, they've gone, oh, well, I only have one med and I get it for $4 at Walmart, so I don't need a drug plan. And they've never even talked to me or asked me, they just decide that. And I'll say, well, most there's certain drug plans that are zero premium or near zero premium, so maybe just get that and then it won't hurt you. And half the time their drug is zero, so it actually does save them a little bit. But so just get the drug plan. That's the thing to do when you're uncertain. And then the other thing to do to avoid the penalty is to, now this is kind of weird, but some people do it. If they have VA and they use VA all the time, they have Medicare, but they're happy with VA and they use it all the time and they're like 100% VA, but they have Medicare, they'll just flat out drop Medicare. I actually don't recommend it, but some people do it. Well, that'll get rid of the penalty, won't it? And then, or sort of the same thing is when they first become eligible for Medicare, they just don't get Medicare because they love VA and they're comfortable. Not everybody feels that way. In fact, that's a small portion, but I have some that are like that, that I've come across over the years. Of course, the easiest way is proactively, I don't know about the easiest way, but if before everything you become eligible for Medicare, before you cross this bridge, you just understand that there's a penalty, but you won't get it if you have credible coverage. And then you don't have to get a drug plan through fear because you've got it. So there's your information about how to avoid the penalty.